Introduction. You will perform a coronary anastomosis using either a portable anastomosis task station or a porcine heart model. The following video depicts a coronary anastomosis performed on a portable anastomosis task station. You will be evaluated in each of 13 components on a scale of 1, poor, to 5, excellent. Both your ability to accomplish the task as well as the overall flow and efficiency of your performance will be assessed. Arteriotomy. Prior to the arteriotomy, fully expose the artery as needed. To gain access to the lumen of the vessel, a longitudinal midline incision along its length must be made. Use a sharp, fine-pointed blade and approach the vessel at a right angle. Pierce the anterior wall with a short stabbing motion, but be wary of injuring the opposing wall. Complete the arteriotomy using scissors to make a smooth, single-track cut that is 1.5 to 2 times the circumference of the graft. Instrumentation. There are several points of technique to keep in mind when performing this exercise. Fingers should be placed comfortably around the needle holder to ensure a smooth rotation without hesitation. Be able to mount the needle on the needle holder with ease. The needle should be mounted 2/3 of the distance away from its point. Modulate pronation and supination of the wrist and forearm during suturing. Consistent yet gentle traction with the forceps should be applied to stabilize the edge of the vessel for proper vessel exposure and needle placement. Be sure to use forceps with care to avoid crushing the underlying tissue. Smooth and seamless coordination of your non-dominant and dominant hand is expected. Anastomosis. Begin the anastomosis at either end of the arteriotomy, passing the needle from inside to outside of the vessel and outside to inside of the graft. Be aware of and use proper angles between the vessel and needle holder when stitching, compensating for the depth of the field. After each stitch, adjust the needle to efficiently prepare for the next stitch. Proper use of suture tension must be maintained consistently. Be careful to avoid suture entanglement. Use proper heel-to-toe orientation for the anastomosis. The heel and toe are labeled here. Keep the graft at distance from the vessel for the first 3 stitches before bringing the graft to the arteriotomy at the heel. Stitch continuously along the edge of the arteriotomy until the heel is reached. When stitching, your needle should make single punctures at a consistent distance from the edge of the arteriotomy. Aim for even spacing between bites, about 2 to 3 millimeters between each successive puncture. To avoid tearing the vessel wall, always insert the needle at right angles to the wall, pushing the needle through its own arc. Tie off both sutures once the anastomosis is complete. Knots should be tied tightly with several throws to prevent unraveling. Either one-handed or two-handed knots may be used. Be sure to maintain consistent tension on the suture and proper follow-through. Your motion should be fluid and efficient. Throughout the simulation, you will be assessed not only on your ability to accomplish the task, but also your ability to accomplish the task smoothly and efficiently without hesitation.
Mm-hmm.